Thank you so much. Thanks to all of you for the invitation. I really appreciate being here. Just to give you a little bit of a sense, I'm not sure everyone is familiar with the office I work at. It's the Office of the Global AIDS Coordinator at the Department of State, is actually charged with coordinating this amazing endeavor called PEPFAR, and that's the President's Emergency Plan for AIDS Relief. So our role is to help coordinate the HIV response in over 28 countries across 7 agencies. It's a big job, and we have about $5 billion a year that go into this specific program. And PEPFAR is really this amazing lab. It's an amazing opportunity because we've gone from 2003 when PEPFAR first started to now to treating a couple thousand people to actually having 4 million people on treatment that are supported by this particular effort, as well as reaching millions and millions of people with prevention messaging and activities through a variety of platforms, not only clinically, but through community-based programs. And we are extremely active in, I think, some of the countries where some of these issues are less well understood and where you don't really have a lot of the evidence. It's kind of what you were talking about, Neil, shifting the locus from these rich countries to really looking at these countries in development. And my role there is to think about this platform that is PEPFAR and how can we use that platform to start thinking about violence and how we respond to violence, particularly gender-based violence, but also violence against children at large. And the challenge there is that what we're trying to do is link to this HIV outcome, right? So it's either prevention, treatment, or care. So that adds another layer of complexity. So it's reducing violence and responding to violence because of, for violence sake, but mostly in terms of how it's related to these HIV outcomes. And I think the big challenge for us over the last years has been kind of moving from just a human rights-based approach to this public health approach, because that's what we're working with within PEPFAR. And I think you've mentioned a little bit of this, and so have others. How that shift happens is really important, to start thinking about this issue from various lenses with a multi-sectoral team that includes not only medical doctors, but a variety of experts. And I think, the good thing is that because there has been so much evidence that's built over the last decade in terms of linking HIV to certain types of violence, like intimate partner violence, like sexual violence, that's opened up the door for us to be doing a lot more than we were ever able to do before. I think within PEPFAR, we've advanced a lot in terms of the response piece. So for example, over the last 3 years through PEPFAR, we offered post-rape care to over 85,000 people. I mean, that's pretty significant if you're thinking of people who are coming in within the first 72 hours of exposure to sexual violence so that they can actually receive post-exposure prophylaxis, et cetera. And there are other kinds of clinical services that we've been able to significantly scale up. I think one of the challenges now has more to do with prevention, which is what we're really thinking about today, and some of the challenges you were mentioning, Neil, which is this idea of at which point do you need that balance between how much evidence do you need to actually start doing, right? And PEPFAR lives at that crossroads because we're implementing $5 billion a year of programming. And so I think the issue is that there is enough that we can start doing. We need to be doing more in terms of understanding, what the situation is at this more macro level. Like, for example, Tanzania has been mentioned a few times. That's, this partnership we have with UNICEF and others as part of Together for Girls, a public-private partnership of which we are part, where we're doing these national level surveys of violence against children. I mean, Kenya, Haiti, Tanzania, Swaziland, moving into a few other countries now have all done these. It's an amazing opportunity to really think about it at the macro level. But in terms of what we actually do, part of it is saying, what? The science also needs to be putting in this implementation science piece into the programs that we're already doing. We're doing so much. For example, through our OVC platforms, and there are a few colleagues here who can speak better about this, we do so much in PEPFAR in terms of strengthening households economically. You know, we do a lot of work with social workers. We do a lot of work with community mobilization. There are ways in which we can start looking at what is the impact of violence that those programs have. And so adding on these pieces to what we're already doing so that we're not just doing programs, we're actually evaluating what's happening at that programmatic level, I think is a huge, frankly, missed opportunity right now that we have to be investing more in addition to some of these more macro level pieces. So I think, you know, part of what I'd like to hear a little bit more about is, you know, how to kind of balance this idea of how much research and evidence do you need before you start doing, and how do you make sure that while you're doing, you're also collecting the evidence you need to do what you're doing better. I think I'll stop there. I've said a lot.
Thanks, Daniela. A really good question. How do you know when you have enough evidence to act? And how can you start to act and still do the surveillance that Neil mentioned? You still need to be collecting more data as you go. Very good questions, and we'll come back. Let me give you a chance, Jerry, to talk about the role of evidence and